expect you to exclude narcolepsy as well. Ask a few questions to exclude narcolepsy. And also, you're expected to take a very comprehensive sleep history. You have to ask for snoring, any evidence of OSA. I think only one of you asked for OSA. So, and also restless legs, periodic limb movement disorder. It'd be good to at least ask a few. And a lot of you ask about depression. I think all of you ask about depression, but very few ask about anxiety. So again, anxiety disorder is also a very comorbid condition of insomnia. Not all of you ask about alcohol use. Not all of you ask about benzodiazepines use. So again, those are points that we can quite strongly against you. Most of you able to talk about sleep hygiene, talk about some of the treatment plans. That was pretty good. So I think those candidates I failed because you all didn't ask about OSA, didn't ask about narcolepsy, and also didn't ask about alcohol use. Okay, thank you.
Okay, so I think just 2 points. The first point is actually something which I think Alex already alluded to, is time management. Okay, I'll come across as someone who has done OSCEs before. I think a lot of us have done OSCEs before. So I don't know how much of you actually keep it to 7 minutes. Or when you were out there, you wrote down, first 2 minutes I'm going to do what, next 3 minutes I'm going to do what, when I'm going to do what, and keep to it closely by watching your watch. I mean, I was trying to pay attention to you guys. I don't think anybody was. So it was like, talk, ding dong. Okay, then we go into summary. Okay, if I'm wrong, I'm sorry, right? That's my own overgeneralization. But I think the time management was, I didn't think it could have been better addressed. So be very clear what you're going to do in the first 2 minutes, last 3 minutes, and then whatever, so on and so forth. That's the first thing. Second thing is, even before we started, Dr. A and I thought it was very difficult, or as a not a very, okay, it could be fairer, okay, the station. So if you had asked, I was trying to lead people on, okay, because I was trying to say, go down this way, talk about medical problems like OSA, even though some of the other actors might not be too keen to ask for these sort of things. So listen to the actor. It will, if you listen to them and they ask you something, then maybe you're not going down the correct way, ask something else. Right? So like someone asked about do you have medical problems, then I asked back, what medical problems do you can cause this? Right? Then when someone told me that you have a circadian problem, I say, oh, is it only because of this? Can it be something else? So when these things come out, I mean, under the anxiety, the stress of it all, try to pick up on this, because that means some things you've not answered yet. Ask these questions, and then you mark it off as yes, and then your grades will go up. So time management and listen to me, right? Ask, do you have anything else? Not at the last minute not when the ding dong is really gone, because then if I ask something, I tell you something, you're not going to be able to fill up the gap. So time management and everything like that. Okay?
No. Just to finish, I have 3 statements to make. Number 1, I didn't fail anyone today, which is not my usual style. Number 2, usually in a real exam, the subject expert does not examine that station. So I never get to examine an eating disorder station because that's my subject area, which I think it's only fair. It's only fair, because then we tend to over-expect too much or under-expect too much, over-correcting for our too much knowledge. Okay? And the third is the actual actors used for the exam are neither taught to help nor asked to sabo. So just be very, don't over-interpret. They're not doctors, so sometimes they say something is purely because it's inside the script only. Okay, so don't assume that, oh, they know a lot more about metabolic syndrome and all that, etc., because they're not doctors. So if they say it's because it's in the script.
Alright, then it leaves me to invite Dr. Lee to give token appreciation to our examiners for coming down.